this point, ladies and gentlemen, I'm going to kickstart the discussions by having a statement from the Executive Director of the National Public Health Agency, Professor Dr. General, I'm going to stop there.
Thank you, yes. From NGH, we want to give a brief statement on where we came from, where we are now, what to go. On the 13th of January 2025, the Honorable Minister of Health declared the outbreak as a public health emergency after we have registered the first 2 cases. We quickly developed a 6-week incident action plan, and that action plan focused on managing mild cases at homes with strict infection prevention and control precautions, whilst moderately severe and very severe cases were admitted in health facilities. Despite recording 0 cases on some days, case numbers rose steadily, reaching 22 cases within the first 6 weeks. And over 90% of the cases that are concentrated in Western urban and Western rural areas. We continue with our treatment of patients at home, and we found out that the numbers continue to rise. We suspected that many of the live cases who did not come into facilities were transmitting the infection in their communities. Therefore, in late February, we launched the Operation Find Them All in these regions to actively seek out unreported cases and encourage them to go to treatment centers to break the chain of transmission. Our suspicion that mild cases remain in the communities our suspicions were confirmed when Operation Find Them All revealed more cases. And the cases started to rise in March, April, and mid-May when we reached our peak, recording 3 digits per day. Sequencing data revealed the critical insight: the virus has mutated to become more transmissible, a characteristic absent in its parent lineage circulating in neighboring countries. Using modeling data, we projected that without intensified efforts, the outbreak would lead to 19,000 cases. In response, we developed a new strategy, that is to make sure that we bring all infected cases out of the community to health facilities. We therefore increased our bed capacity from 98 to over 700 countrywide. We also did an expansion on home care because you cannot get everybody to come. So those who decide to stay at home, reluctantly, we make sure that we actually deploy the necessary resources to look after them. We intensified community engagement and sensitization efforts and also deployed vaccines. We vaccinated over 150,000 people, trying to cut the chain of transmission, that is, vaccinating all contacts and health workers. Sending samples to Senegal. We started testing our samples here, and at the Central Reference Public Lab at Kelima Government Hospital, and the protocol lab that was actually currently run by Institute Pasteur from Ivory. Lower rates, the Honorable Minister of Health called us to action that this we must intensify and deploy all the resources that we have, which we did. As of today, we have 5,132 confirmed cases. Out of these, 4,997 have recovered, with 51 deaths and 84 active cases. So we have only about 54 active cases in the country, with over 90% of them in our facilities. The majority of cases are males, 52% of them are males, primarily affecting young adults aged 20 to 39, with a median age of 28. While MPOX remains designated as a contact disease transmitted through skin lesions and contaminated personal effects, a growing body of evidence points to the significant contribution of sexual transmission, including virus isolation in anal and mucosal swabs of recovered patients, predominance in young sexually active patients, and significant number of cases recalling sexual exposure to infected cases prior to symptom development, and the outbreak's disproportionate effect on employed older males compared to school-aged younger females. The next steps. We want to ensure that all cases are identified, contacts are listed, they are vaccinated, and monitored for 21 days to detect cases easily for isolation to break the chain of transmission. 2, we want to move all new cases into health facilities for comprehensive care. 3, we detect more cases in communities through active surveillance rather than waiting for them to come to facilities. And 4, to ensure that we epidemiologically link all cases to understand the transmission pattern and prevent further spread. 5, maintain a robust surveillance system to detect and respond to any resurgence in transmission. 6, we continue with community engagement and vaccination efforts in high-risk populations. And 7, we strengthen cross-border surveillance and coordination with neighboring countries. Ladies and gentlemen, this is the brief from where we started, where we are, and where we want to go. Thank you very much.
Thank you, Professor Sir. I actually think if we follow him, we should applaud the little There's a lot of great news in this presentation. It's no longer the flicker at the end of the tunnel. We're having a glow. It's becoming brighter. Sierra Leone is known for this kind of success in our fight against viral infections, epidemics. Done it before, and we are showing that we can do it again. 8 months since the minister declared the outbreak. We just did not do any random intervention. Professor Sarr said we did our case management plan. It shifted. The initial plan was to treat at home, but that shifted because of changes that occurred in transmission processes, including mutations of the virus itself. But today, we're happy to report that I'm going to be interchanging Dr., Professor, General. I'm going to be interchanging. It's the same person I'm talking about. Professor, sir, thank you so very much for your hard work. that's good news. We will at this point invite the Deputy Chief Medical Officer, Monkeypox, to make his statement.
Thank you, Mr. Chairman. Honorable Minister, Executive Director of Partners, distinguished guests for this. Good afternoon to you. Well, the NPHA is a semi-autonomous agency, but directly supervised by the Minister of Health. They are not working in silo. We've been working hand in gloves since the declaration in January. And together after the declaration and the EOC was activated, equally we informed all our district medical officers to activate their district emergency operation centers. And all the pillars on the public health emergencies were activated at district level. And not only that, our hospital staff and our district health management staff were oriented on the MPOX. And all districts, as I mentioned earlier, we established isolation and treatment centers in the districts as well, not only in Freetown. And we've ensured that not only at hospital level, but also at community health center level, they've established isolation and treatment centers. And not only that, our staff have been trained and have been actively involved in the outbreak in partnership and with the lead of NCH. And we did not only stop at that, we periodically meet at a national level, at the technical level. And up to last week, we had a meeting where we visited. We went back to the drawing board after receiving, can I say, new directives from our political leadership from the minister. We held again our technical meetings where we will meet with the pillars of surveillance and case management. And we visited the strategy as the executive director just mentioned. And we just finished our key stakeholders engagement meeting yesterday, where not only myself was involved at the opening ceremony and the closing, but also the deputy minister one in charge of public health also graced the ceremony. And as we're speaking, the district medical officers and medical superintendents left yesterday with a new plan on how to revisit again our strategic response to the outbreak. Because we've got the directives, what I want to go by the timeline given by the minister to ensure that we don't only say single digits reporting, but want to say zero reporting on the MPOX cases. It's just mentioned about the vaccination of all contacts and high-risk groups. We're intensifying on that. We're giving the directives to all the surveillance officers that all suspected MPOX cases need to be isolated, tested, and their contacts line listed and vaccinated. And we've ensured that support will be given to all the treatment centers at hospital and community health center level. And as I have mentioned, we've also ensured together with NPHA to give support to the districts to have more community health workers involved for community mobilization. In such, we are trying to ensure that we plug down the curve to zero reporting based on the timeline that will be given by the Minister of Health, which I will look for him to declare here. We just want to be assured that technical level, our health personnel are actively involved on the outbreak response, and will continue to be actively involved in ensuring that we meet the deadline given by the political leadership. So with that, I want to reassure the public that we will continue working hand in glove with MPH, both at facility level, at peripheral health clinic level, and at community level. We'll be working with our community stakeholders. That includes the local councils that were involved in the engagement for the past 2 days, the paramount chiefs, and civil society organizations and our partners to ensure that we bring this outbreak to an immediate end. Having said that, I want to thank you for this audience.
Thank you, Dr. Wu. We will now very quickly move to the next speaker, and that's going to be a representative from the Office of the VR. You're welcome, sir.
Yes, thank you very much. The Honorable Minister, the Executive Director of MPHA, Senior Prime Sec of the Ministry of Health, the Deputy CMO of the Health, representative of UNICEF, representatives of other partner agencies here present. I can see the CMO too, Dr. Kara, some other program officers and directors here present. The gentlemen of the prize, ladies and gentlemen, it is a great pleasure for me to be here today, standing here representing WHO and specifically representing my boss, Dr. George Ane, who is the country director of the WHO, who is currently out on other assignments, and who will not be here. But because of that, he has asked me to stand on his stead here. We've heard a lot from the director of MPHA, the CMO, too, public health, all what's been going on so far. But I just want to maybe to put it in the global perspective scale to say that MPOX actually has been around for quite a while, and if we cast our minds back to 2022, it was in 2022 that WHO declared MPOX it is a public health emergency, a public health concern, in fact. But since last year, 2024, the virus took a different stance by becoming more virulent and moving from country to country, within the African continent as well. It's not only Africa is affected, it affects different countries globally, but we are more concerned with our own here. And in Sierra Leone, like the director and also the MPHA mentioned, this year, July this year, the minister himself declared it as emergency in the country, and since then, all hands have been on deck. And from the WHO end, we've been very, very much working closely with the Ministry of Health to ensure that this outbreak is brought to an end as quickly as possible. And at the regional level, we're working together with other global partners at the continental IMSD or MPOX, particularly UNICEF, African CDC, Gavi, CEPI, MSF, to name a few. A lot of partners that are working on this at that level, and we've all been working together to make sure that this outbreak comes to an end within the shortest possible time. Everything to just there's a little bit to say that 24 countries in Africa have reported cases this year, 2025. So Sierra Leone is one of the countries. I'm saying it so that we know that it's not only a Sierra Leone problem, it's a problem that is affecting the whole of our continent, or a number of countries in our continent. In May, we noticed an upsurge of cases, but I want to posit and to particularly note that we now see a declining trend in the number of cases. And I would therefore like to sincerely thank the Ministry of Health and the MPHA for the great work they've done, and they still doing, and we know that they will continue to do until we get to 0 cases. I would also like to particularly acknowledge the great leadership of the Minister of Health, Dr. Austin Denby, for his outstanding leadership in this process. And like we all know, a tree does not make a forest. The Director of PG has given us a good narration of what has happened so far. So we, as WHO, actually sincerely want to thank the Director of MPHA together with his colleagues, the MPHA, the directors, and the director, team of surveillance officers have been working in this area to ensure that this outbreak comes down. Having said that, it would be out of place for me not to thank particularly the partnership of the IMST, the Continental IMST that I mentioned before. So a great thanks goes to all of them, UNICEF, African CDC, Gavi, MSF, CEPI, World Food Program, OIM, and of course CDC, USCDC, and its implementing partners within the country that have been supporting this effort. So throughout the different phases of the pandemic, I want to note that the WHO has been solidly behind the Ministry of Health and providing good technical, financial, and logistical support by way of a lot of items that have been donated by WHO to support this process in the country. Technical expertise has been provided by WHO. We provided technical experts, consultants, as well as TAs that are in country. Some have come and gone, and more are still coming as we go along. Financial support has also been provided by WHO to support this effort, and facilitation of vaccines, provision of vaccines, as you know, about 230,000 doses of vaccines have been provided in the country through facilitation efforts by WHO and other partners. And in fact, more vaccines are also coming, expecting about 67,200 doses that will be coming into the country in the shortest possible time. As we move now, we are in a critical phase whereby all hands need to be on deck. The minister has given the order, let me use that word, that he wants to see count 0. And we want to see today, if possible, maybe yesterday. However, we are continuing to commit ourselves to this. And as I speak, plans are in progress to dispatch or to send another set of different teams to different parts of the country to ensure that the work that was continued during the first phase of the massive support will continue within the next, from next week actually. We believe that this will be able to bring down the number of cases collapses. So I want therefore on behalf of the WHO to reaffirm our commitment to working hand in hand with the government of Sierra Leone and all the stakeholders to stop the outbreak within the shortest possible time. I'm therefore happy to be part of this national conversation, which I hope will strengthen our collaboration with the various stakeholders here. And also, we are calling all partners, all stakeholders, all health workers, all who are in position to provide one form of support or care to put all hands on deck and make sure we work assiduously to bring this number to zero. Together, we can ensure that the MPOX response leaves behind a stronger and more resilient health system in Sierra Leone. With this, I want to say thank you very much. Thank you.
Thank you so very much. WHO is a traditional technical partner of the Ministry of Health. And so what we're sharing today, the good news, the not so good news, we are very much part of the experience. Thank you so very much. I have to particularly today recognize the role of the media, our media friends, being in this journey with us. And so, at the point, we bring them along to share the news to the rest of the country. I want to recognize the representative from UNICEF, who's always doing with us. Dana, thank you for coming. I recognize Dr. Kaba, the DCMO clinical, whose clinical work is integrated in this public health, in this public health space. Our senior medical professionals, you're welcome, and thank you for the role you've played. We've come to the high point of this discourse, and I'm going to present to you I think we'll make a little adjustment. We're not just recognizing UNICEF, we're actually giving them a deserved space to make a statement.
All the high-table participants, dignitaries, and all the media present. I think after so many high-table, high-post people talk about it, there is not much for me to say, but still I want to highlight two important things, which is, if there is a public health emergency, we think that we have to stop it. But there is one thing more, we have to revert it. And how fast we revert it is dependent on if the vaccination is available, how quickly we make that vaccination available for all the cases, all the contacts, and all the service providers at one priority. the important thing about MPOX vaccine, that MPOX vaccine is, I think, among the costliest vaccines that are available for stopping any disease. And we should be Sierra Leonean, be thankful to our leadership that they managed to bring the vaccine to our country. So I think we all deserve to be blessed with such a leadership. And it's not small quantity. Till date, we have received 206,000 doses of vaccine. And out of that, 152,000 has already been vaccinated, and we have a balance of 54,000. The important thing about this, in addition to UAE and our traditional part of your traditional part of Gavi and Ireland giving the doses in a fixed in a frozen form. I'll tell about the frozen thing, but importantly, our two other partners, UAE and DRC, has came for the rescue. That also shows the partnership, the friendship, our leadership enjoy with these two countries. Thank you, sir, for maintaining it, because we received around 95,000 doses for the children, for the people, for the pregnant women, and for everyone. I think this is very important, and how quickly you mobilize the resources. If it is available within country, use it. If it is, you have to get it as donation, but donation is nobody give you until and unless you have that level of partnership and friendship. So I think this is the main thing which we all should enjoy at this point of time. We say vaccine is there, but how the vaccine is taken. And then when it comes to the frozen state, I just wanted to give one more example. Because the UAE and DRC are received as a dilute state. 95,000 doses received dilute state, which need to be used in 6 weeks. And for your information, and thanks to the EPI team and PHA, we have a zero wastage of those doses which should be used within 6 weeks. This is not a simple thing in a country like Sierra Leone. We should admit that we are all aid our forces together. But those who are remaining, there are around 54,000 doses which are remaining, and we are expecting 67,200 doses again. The storage of them is not easy. At national level, you have to keep them at minus 25 degrees centigrade. And Sierra Leone is capable to maintain that. I heard from many of the other colleagues in other countries, and they said we are not accepting more doses because we don't have capacity to store them. Sierra Leone is able to store not only 54,000 but 67,000 doses more. Minus 25 degrees centigrade at the national level. This is not a small achievement. And I think we should not think that cases increase, cases reverse, but we have to see how our system is being able to respond to that problem. Problem must be there, but there should be response. And this minus 25, the ultra cold chain, the cold storage equipment, government designed to buy it during the post-COVID support from Gavi. So we have to prepare for what is coming next. And I really want to congratulate you, sir, for your leading such a wonderful team. And I really enjoy every day to work with you. Thank you.
Thank you. Thank you very much. When Bandana speaks, she crystallizes the picture, the weaved integration of UNICEF into the health system of Sierra Leone. This is what it's supposed to be, and this is what UNICEF has done. Thank you so very much. Thank you. I will recognize CDC in this background. Thank you. Thank you for what you've done. And thank you for what you continue to do. We come to the high point of this discourse, and I'm going to invite a leader who, by every description of the word leader, lives and walks the definition of it. of Health has provided strategic leadership to this ministry. And in this difficult time, he provided that. But perhaps it's because of his background. Well grounded in public health, well grounded in viral studies, immunology. He brings all that experience and skills to bear on what the ministry faces on a daily basis. He's very much a part of this story that we are telling. This challenge that we face. Ladies and gentlemen, I invite the Honorable Minister to make his keynote address.
Thank you very much, P.S. I know you're not really here to hear me today. It's a discourse, so we're looking forward to the exchange and between you and the team, and I'll be a very good observer. I just want to comment a little bit on, again, VP always says this when you're last to speak and everybody said everything that needed to be spoken. There's very little you could do but ask people to clap. But I want to just reflect on what our colleague from UNICEF just shared with you. These vaccines are not available to go buy if you want, even if you have the money. A lot of the vaccine has already been bought by institutions, by countries, and they're allocated based on strategic dialogue between them and the host country. And these are perhaps some of the most expensive vaccines that you have in the world today. I think it's in excess of €100
Yes, sir.
a dose.
Yes, sir.
€100 per dose. But most of these other vaccines are $1, maybe 50 cents a dose. It's over €100 per dose. So for Sierra Leone to be able to secure over 200,000 doses for our need, it's a testament of several things. First, the people who are giving it trust that we will use it appropriately. Secondly, you also have a very solid team that's worked together, that demonstrated time and again that we don't only have the infrastructure, but we're able to deliver high quality vaccination services across the country for our routine vaccines. And not only that, we've introduced new vaccines as well that we've been able to effectively deploy. So again, it's a testament to the group. I want to say thank you to the ministry, thank you for the help. Now let's come to the matter at hand, the MPOX situation. Again, everything that needs to be spoken has been spoken, but I wanted to provide some broader context. In Sierra Leone, we've seen several outbreaks that we've effectively managed. At times it's slow start, at times it's complicated, but in the end, we overcome it. And the lessons learned that prepare us better for the next outbreak. The executive director, again, at times you're confused. He's doctor, he's professor, he's brigadier general. He's actually in active service. And so he's no nonsense guy. And when he says something, he means it, and you can count on him. He's able to effectively carry things on. So here's the journey. In January, we saw the first 2 cases in the Western area. I really want you to remember that. 2 cases. 2 cases in the Western area. We declared an emergency. And when you declare emergency, that means you bring all of the assets together to fight the emergency. We did that. 2 cases. Most of the cases were mild, and we presented with synaptocorona. We diagnosed them, we treated them, and some that were severe, we kept them in hospital. But some that were milder, we said go home and take care of yourself and protect you and your family. And we found out that it just did not work. When people went home, They didn't stay at home, they moved around, and the numbers started rising. Every time we send somebody home, they're ambulatory. I'll give you an example. One of our colleague ministers went one afternoon to play football with some colleagues. He went out there, and this guy rushed, "Hey, Mr. Minister, how are you? Great to see you." And he had some spots on his face, and the minister was like, "Hey, what's going on?" He said, "Oh, man, I've got all this rash all over my face." Of course, he panicked and called emergency, and they took very good care of him. But the message here is when people are ambulatory, they're effective in transmitting the virus. And I think that's what we saw. From 2 cases, you got over 5,000 cases in the country. From 2. So the first few months, they were actively spreading the virus, mostly in the western area, western urban and western rural. And so, the professor and his team and the ministry and our development partners, we are driven by data. You look at the data and you see what the data is saying. The data is telling you that there is rapid increase in the number of cases. And what that means is your strategy of initially diagnosing and managing people and asking them to go home may not be working as well. At the same time, we had vaccines. Vaccines were available, but people didn't see the seriousness of this initially, and so people didn't come in for the vaccines. But when the numbers became really so profound, and some of the images came out with people's private parts falling off, the community demanded action. The NPHA organized around it. The ministry pulled all of the districts together. Our development partners all came together and said, we will change the strategy now from allowing people to be managed in the community to ensure that we bring them into a space where they can be managed effectively. The challenge we've had all along is during outbreaks, when the whole country's attention is focused on the outbreaks, more people die from routine services that are not being met. So we were making sure that as we respond to this outbreak, we also have an effective system to ensure that services are uninterrupted. So that's why we created these holding areas in Hastings, in Calvert Town, in Port Loko, and even in the hospitals. We moved them from the main hospital into isolation bays. Now there's a big advantage with that. Again, throughout all of this, there's the biomedical response, which we all are able to manage, have expertise in. The second part of this is public health. The public's active engagement as equal partners in this effort. So the next strategy is, if we identify infected people, we bring them into a facility where they get maximum care and support. Their health is improved considerably. Their recovery rate is faster. Secondary infections are managed. And it's good for them and their health. But by also removing them from their homes, they are also not transmitting it within the households or within the communities. So this new strategy had a twofold approach. One, extract the infected person, put them in a place where you could care for them very well, and at the same time, where they came from, intensify the prevention efforts within the households, within the neighborhoods, within the communities, so that you could interrupt transmission there. When this new strategy was deployed, the numbers started coming down. Week by week, it started at the peak of the outbreak, we had close to 2,000 active cases in the country. 2,000 active cases in the country. These numbers have come down so rapidly that today we have 84 active cases in the whole country. And of the 84 active cases, over 90% of them are in a facility. The remaining 10%, we have this new strategy they call man-to-man market. When you have a large number of people, it's very difficult to manage. Yeah? You use macro level engagement. When you have these small numbers now, you need to zero down on these numbers for us to get to zero. So now the strategy is now man-to-man, case to case. So for every case, we want to know the case, we want to identify the case, and we want to do everything we can to ensure that this case could come to a facility so we manage them and ensure that they're healthy and strong and can go back into the community for their own health and also without transmitting it to others. So here's the exciting phase. Some days we get 0 in the whole country. Some days we get 1. Today I believe the numbers are coming out, but we have 6. And yesterday we had 12. The other day we had 0. And so again, it's come down. You know what? But it's not 0 yet. Our focus now is to make sure that we get down to 0. And when you get down to 0, it's not enough. You have to maintain 0 for 42 days before you say the outbreak is over. So now we're looking at getting to 0. Every case matters. We want to know the case. We want to know where they live. We want to know about their neighborhood. We want to bring them in for care and treatment. And at the same time, we want to intensify prevention measures around their home, around their neighborhood, around their contacts, around the community.